All right, we're live.
All right, thank you, Dominic. Good evening, everyone. I'm Amy Hendricks, Deputy County Administrator here in Tompkins County, and here we are at the start of a new year, so Happy New Year to all. We are seeing a swirl of updates in the COVID landscape, changing guidance, shifts in procedures, and tonight we're going to dive right into the discussion on these changes and answer your questions with Tompkins County Public Health Director and Mental Health Commissioner Frank Krupa. So with that, I'm going to dive right in, Frank, and start asking you a bunch of questions. We're going to start with, we're going to start with what's happening here in Tompkins County. Can you provide a snapshot of the current state of disease prevalence here in our community?
Of course. Yeah, it's been an interesting few weeks with the holiday season, the departure of many of our higher ed students, on the heels of a giant spike in cases. So there's been a lot happening. Our case numbers have come down from that original spike with the higher education students, but they are up, from the broader community perspective. And what we know is that Omicron is becoming the predominant strain here in Tompkins County. And so we also know from that experience with our higher education students that the transmissibility rate is significantly higher with Omicron. So it's not surprising to see the case numbers going up. What's important and what we're really focused on, and we've been saying this for a while, is the severity of illness and the hospitalizations. And so for a while there, our hospitalization numbers were pushing up towards high teens into the low 20s, which we hadn't seen for quite some time. They started to come down now, getting closer to single digits each day, which is good. What we also know is that much of that hospitalization increase was a carryover of the Delta wave, the Delta variant wave that we were facing here in the community, but as we had an Omicron spike occur. So we had those two things happening simultaneously. And what we know is over the last few weeks, as far as hospital intakes are concerned, about 75% of the people that have presented to the emergency department for COVID-like symptoms that were discharged from the emergency department, meaning they were not admitted to the hospital, were Omicron variant. And about equally 75% of the people that ended up being admitted into the hospital were Delta variant. So we still know that the severity that we were seeing reflective in our hospitalization numbers was driven by the Delta variant. So good news is as Omicron becomes more predominant, hopefully the trend will continue where we see hospitalizations continue to decline, even as we see case numbers continue to grow.
And Frank, you touched on this a little bit, but I just want to draw out, where are the cases that we're seeing right now coming from? The college students, for the most part, are gone. So is this mainly community spread? Is it gatherings? Where are these cases coming in?
Yeah, I mean, it's everywhere, right? I mean, I think, the COVID is out there and you can get exposed in most any place that you go out in public. As far as transmission, households are still the primary location, right? Because we're spending the most time with those people. We're not socially distancing, probably not wearing masks. And so, the potential for exposure is significantly higher. But gatherings, certainly over the holiday season, has been a driver. Travel to other parts of the country and returning, other parts of the world and returning has played a role in it. But I think, we do have a significant component of community spread. And I think generally speaking, we just should know anytime we go out in public, there's a potential for exposure to COVID.
All right, thank you, Frank. I'm going to jump to quarantine and isolation guidance. This is something that has been updated and changed in the last couple of weeks a few times. So the CDC recently announced recommendations to shorten isolation and quarantine for the general public. Can you explain what's been adopted by New York State and what that means for people who test positive or are exposed to COVID?
Yeah, it's the big news of the last 24 hours, right? We had heard the CDC had recommended a reduction, but they hadn't provided guidance. And then last evening, both they and the New York State Department of Health did provide guidance on reducing isolation and quarantine. And we have adopted that today here in Tompkins County. So what does it mean? it means for most people, isolation and quarantine will be limited to 5 days. So if you test positive or have symptoms, we're going to want you to stay home for 5 days from the onset of symptoms or your positive test result. Not everybody will be eligible for release at 5 days, right? Those that are severely ill, that still have symptoms, they will likely be asked to do the 10-day isolation. If folks are immunocompromised, we will likely ask them to do the 10 days. And the reason for that is they are not, their bodies are obviously not fighting the disease off as effectively. And so therefore they still have more virus to potentially shed and transmit to other people. So really the rule of thumb will be when you hit your 5-day mark, if you're asymptomatic, meaning you don't have symptoms, or you have been without a fever for 24 hours, without fever reducing medications, of course, and your other symptoms have been resolving, you will be released from isolation. All right, so it's important. It's not just an automatic thing. There are still folks that will be asked to go for 10 days. Now for quarantine, that's shifting a little bit. It was before that if you were fully vaccinated, meaning you had your first 2 doses or 1 dose of Johnson & Johnson, you were not asked to quarantine. That's shifting a little bit now. And we're adding in booster dose requirements. So if you've been boosted, you will not need to quarantine, similar to having been fully vaccinated before. If you've been fully vaccinated, have your 2-dose series or 1 Johnson & Johnson, and are eligible, meaning the time frame has passed 6 months for Pfizer and Moderna, 2 months for J&J, and have not been boosted, you're going to be asked to quarantine, right? So again, vaccines are so very important in helping us fight COVID. So we would really encourage folks to get vaccinated when they can. And Amy, I do want to talk a little bit about the why. I don't know if you have another question that'll get to that.
I might have that question coming up. Does this mean that there is updated science mean that if you're not symptomatic, you're not infectious? Why are these changes occurring?
Sure. And this is really important. And I hope that I'm able to explain this in a way that folks can understand. And if not, I'm hopeful that over the next days and weeks, we'll be continuing to put out information that helps make this as clear as we can. So what the data is showing that the CDC is providing is that for the Omicron variant, people are most infectious for the 2 days prior to the onset of symptoms and the 3 days post onset of symptoms. So that's when they're most infectious. So by using 5 days, the expectation is that most people will not be able to transmit the virus after 5 days. It's not everybody. So we're not saying that if you stay 5 days, there's no chance you're going to give COVID to somebody else. That's not what we're saying. But what we are doing is, as we have throughout the pandemic, is we have to weigh the public health intervention mechanisms that we're using to limit the spread of COVID against the impact of those interventions. So back in March of 2020 and all of 2020, we didn't know a lot about COVID. We didn't have tools like vaccines and soon to be coming antivirals to help us address COVID. And so it was necessary for us to take significant public health steps to limit the spread, to protect our community. And our community did that. And I think if you look at the data, even compared to our region, the work that our community did saved lives here. And so it was extremely important that we did what we did. Now we have Omicron and we know more about it. It looks to be less severe, albeit more transmissible. And we know that we still need to protect the most vulnerable, our immunocompromised and our seniors. So we're not eliminating everything. We're still asking for masking indoors. We're still asking people to isolate and quarantine for 5 days to help protect those vulnerable populations. But when you measure the impacts of longer isolation and quarantines, there are significant impact on our ability for our community function, right? We've seen that. It becomes de facto shutdowns. Right? Our schools can't operate. Our healthcare workforce is diminished. Our first responders, there's not enough available. And so we have to weigh the impacts of that against, the benefit that we would get from the low risk of added infections because of people transmitting the disease after 5 days. So it really is, and as it has been throughout the pandemic, and it may not feel that way because in the beginning we were just shutting everything down, right? With really without a lot of conversation about the impacts that would have, other than addressing them as best we could. Now we know what those impacts of shutting down were, and we have to weigh the benefit of doing an intervention to limit the unlikely spread of disease past 5 days against the negative impacts to our community that having longer isolation and quarantine periods would create.
Thank you, Frank. That's a lot of information on this. One other thing that I just want to ask is, it says you need to continue to wear a mask for 5 days after. Why is that? What's the importance of that?
Yeah, thank you. Sorry I left that out. Yeah, so yes, after the 5-day mark, we're going to be asking everyone to wear a well-fitting mask. And we can talk a little bit about what that means in a minute. But the reason for that is it's an added layer of protection. We've been talking about layers of protection, the Swiss cheese analogy, for going on, a year and a half, 2 years now. And really, because we know it's not zero at 5 days that somebody could transmit the virus, wearing a mask is an added layer of protection for the people that individual might come in contact with. So it's really important that if released at 5 days, that a well-fitting mask is worn. There's been a lot of conversation about what is a well-fitting mask. Generally speaking, you just want something that's snug to your face, preferably that has a nose piece that can be tightened around your nose. If it's cloth, it has 2 layers of cloth associated with it. There are other ways with double masking and other things, and there's good information on the CDC website about what that looks like. But generally speaking, if you've got a looped ear mask that's holding your mask close to your face, hopefully it has a metal piece in the nose to go around the nose. That's what we're talking about. We're just trying to limit you expressing the virus, if you can, farther away from you than is absolutely necessary.
Right, Frank. You talked a little bit about Omicron, and I just wanted to know, is it less harmful to children than previous variants? Is that one of the reasons for these changes, or how does it impact children?
Well, generally speaking, from a severity of illness perspective, thankfully, children have not been as severely impacted. That's been the case from the beginning. And certainly Omicron seems to be following that same path. The reason that we're asking children to do the things that we are, like wearing a mask at school, and other interventions, is they can get COVID and then they can give it to other people, right? And the more spread that we have, the more chance it is that the virus will reach one of those vulnerable people in our community that could have a more severe reaction to it. So, while the illness in children might not be as severe, they are part of our community, as we all are, and we're trying to take steps to protect the most vulnerable, and that really takes all of us taking some steps.
And one thing I will add in here too is all the isolation guidance and those updates that you've talked about. I know our public information officers and the communications team has done a great job of putting all that information on our website, and just issued a press release on that too. So it's a lot of information, and if people don't want to rewatch you, Frank, which they are welcome to do, we'll continue to share this on our YouTube, but they'd rather read it. It is available there. So let's talk disease prevalence a little bit more. There have been delays in case investigation. Why are those delays happening? And if they're delayed, how does someone get documentation of isolation if they've not been contacted yet?
Yeah, really good question. And the short answer on why there are delays is sheer volume. It's the sheer volume of cases and our ability to get to all of them. With the shift in isolation and quarantine to 5 days, and the volume of cases that we're dealing with, the effectiveness of health department ordered isolation and quarantine is beginning to diminish, simply because by time we're able to get to those cases, 5 days will have passed, right? And then for somebody in quarantine, will be even more likely that 5 days might have passed before we get to those individuals. So the usefulness of health department led, meaning a formally ordered isolation and quarantine, is kind of coming to its natural conclusion in the evolution of responding to a novel disease like COVID. It doesn't mean that isolation and quarantine is not still important. It is very important, and one of the best tools we have available, with vaccines to help us prevent spread. But we're going to be shifting to a self-responsibility model, right? The expectation will be in our community that if you test positive, or even if you just have symptoms and choose not to get tested, you should act as if you are positive for COVID and isolate yourself for the 5 days, right? So we're really going to be asking our community to do this. And we know it's a lot. We know, and there's going to be people saying, you're crazy, nobody's going to do that. I don't think so. I think our community has proven that they will do what is appropriate and necessary to protect each other. And so we're going to be providing information about that over the coming days and weeks. We're expecting early next week new guidance from the New York State Department of Health on case investigations and contact tracing, which will reduce the amount of that's formally occurring through the local health department. So be prepared. That's coming, and we're going to be talking about that. And it is just the natural evolution of how we address this disease. To answer your question about people needing documentation, so there's work going on to address that. We have for folks that are doing home tests, we have our form on our website where folks can submit their information and then get in return an automated email that is documentation that they submitted a positive result to us. And New York State is also working on an automated system for those that would test positive through a lab-based test. Those that go into the state system and have traditionally been case investigated by the health department, they're working on a mechanism to be able to provide documentation associated with that. So more to come on that, and it's coming quickly. Probably within the next week, we'll be having information, about what that will look like. One of the challenges that we're facing, and I guess this is a call to arms for our community, is a large reason that we need that documentation at this phase is for the paid leave off time associated with it. And that was a great program to allow people to stay home when they're sick, because we absolutely need them to do that. The problem is when the law was written, it required a formal isolation or quarantine order from the health department. And so as we transition now, we need our state legislature to adjust that. We certainly still support paid leave for folks that are sick in New York State, but we need a different mechanism for documentation associated with that. So talk to your elected officials, your state elected officials, let them know this is important to you, and we really need them to work on a solution that works both administratively from a documentation perspective, but is not hinged on something that public health doesn't believe is the most effective tool to fight COVID as we evolve.
Okay. And to be clear, we still want people to stay home if they're sick, and so that's a big piece of this.
Yeah, absolutely. That has not changed. And regardless of whether it's the health department giving you a formal order or you just knowing this is the appropriate thing to do, stay home if you're sick, right? That will be the single best thing you can do besides getting vaccinated to help us limit the spread of disease. So please stay home. Please work with your employers around the paid leave issue, and hopefully we'll get some relief on the process and the necessary documentation in order to access the state-sponsored paid leave.
All right, thank you, Frank, on that piece. I'm going to shift over to talking about Delta and Omicron and what we know about it. Maybe to begin, though, if you can explain how we know about the prevalence here, and then any additional information we have about local trends of the two variants.
Yeah, I have to give credit to the Cornell Virology Lab. Dr. Diego Deal is leading a research project around variants for his work at Cornell. And thankfully, and to their credit, they have been willing to adapt that research to provide us real-time near real-time information about variants in our community. And so that is really why we know. And we are so thankful that they were willing to make those adjustments and saw the public health interest in providing us that information. It's not easy to do. Sequencing is a complex process, and it takes time, and they really expedited things so we could have a picture of what was going on. And quite frankly, we were one of the first in the country to see an Omicron spike. And we were also one of the first in the country to actually be able to tell you that it was an Omicron spike. And I think that really added context to what was happening here in our community for us, but also as a leader for the country. So folks could understand that Omicron was here and that if you have it in your community, you can expect to see case numbers increase because of its transmissibility. So thank you to the Cornell Virology Lab and the work that they've done to help provide us that information.
So any additional information on Delta and Omicron here that you want to share?
I think generally we know that Omicron is moving towards being prevalent. I talked about the hospitalization information that we have, knowing that the severity still seems to be connected to the Delta variant. And we're going to see cases. We know that that's part of what happens with Omicron is the transmission rate is more. Hopefully, similar to South Africa and other parts of the world, we will see that spike and drop off and see our case numbers come down. But other parts of the country are now just starting to see the Omicron spikes. So, we could see another wave after this, and that's just going to be part of, this winter season in particular, as we go through upper respiratory season, and knowing that folks are more susceptible this time of year. So we'll see, and we're still going to monitor it. COVID's not going away, and all of these changes are not to say that COVID is going away. It will be with us. It's just our approach to addressing it is evolving.
So you just mentioned upper respiratory illnesses, and I had a question come in about if someone has an upper respiratory illness, they think it's flu, bronchitis, pneumonia, or maybe could be Omicron. Should they get tested, get sequenced, or would there be different treatment if it were an Omicron versus bronchitis?
So if somebody is symptomatic, we are recommending they go get a PCR test. Right. So that is our recommendation for anyone that's symptomatic or has been a close contact of a known case. We do recommend that they get the PCR test because that's still the gold standard. It is the most likely to detect the disease early and at lower levels in your body. So we do recommend that the symptomatic folks get tested. As far as treatment, you really should talk with your healthcare provider. They know you better than anyone. They know let me say that differently. They know your health, the health of your body better than anyone. And they know the particulars about any contraindications or, other illnesses or disease history that might be complicated by bronchitis or COVID or flu. So they're really your best resource when it comes to learning about you and what a particular disease might mean to you. Treatment for COVID, I mentioned there are antivirals that are close to coming to market that will be another tool to help us, provide some treatment to folks that do contract COVID. They're not widely available yet, and we're hoping that will happen soon. But really talk to your healthcare provider about your individual healthcare needs. But if you're symptomatic, take advantage of the testing at the mall. It is free to Tompkins County residents. And there's free transportation through TCAT to get there if you need it. I'm sorry, that's vaccines. I keep screwing that up. Somebody stop me. Don't get on public transportation if you have symptoms. Do not do that. Forget I said that. I'm sorry. Completely wrong advice. Do not do that. But if you need testing, hopefully you can get yourself to the mall or coordinate with your healthcare provider to get testing through them and or advice on what you should do with your symptoms.
Right.
But most importantly, stay home. Don't get on public transportation. Don't go to work. Don't go to school. If you're symptomatic, we want you to stay home.
And if you can't get transportation to get to the healthcare provider or get an at-home test delivered or something like that, you can contact 211 for those who really have no other option, and they will help with the option. But since Frank has set up so many different systems from vaccines to testing sites, I'll give you the go on the mix up there. One thing I do want to jump back, I just had a question come in about the 5-day guidance. And how does it apply to schools and childcare settings? Can you talk a little bit more about that and if there's any differences there, or what does that do?
Yeah, so the 5-day applies to everyone, as we described it, in every age. What is going to be different in those congregate settings like schools, childcare, nursing homes, is the case investigation and contact tracing component of it. And I don't have all those answers tonight. I want to be honest. I don't know exactly how that's going to look. I said before, we are expecting guidance from New York State on what their expectations are around contact tracing and case investigations in those congregate settings. Once we receive that, then we'll have to kind of dig in and figure out how we implement that successfully here in Tompkins County. So I don't have real good answers tonight on that, but I'm hopeful by next week we'll be talking about what case investigation and contact tracing is going to mean for the broader community and for those more specific congregate settings.
All right. Well, thank you for that, Frank. I'm going to jump to masking real quick. You talked a little bit about the masks, and there's a mask advisory currently, or a mask mandate currently in place from New York State. If that mask mandate is not extended, would Tompkins County continue to enforce this measure, or would we be reverting back to our mask advisory status?
Yeah, I imagine that if the mask mandate is lifted by New York State, it will be because things have changed related to the disease in New York State, including Tompkins County, and we would likely follow that same direction. I've said this before with the masks, that mandates they carry the requirement of enforcement. That's really the only thing that makes them different from the recommendation that we had in place. And I think we've had the conversations about what enforcement looks like with mask wearing. It's very difficult. And I'm hopeful that regardless of whether there's a mandate or recommendation, that our community will continue to respond as they have and do what's necessary to, protect themselves and each other.
All right. One other question on masks, and I'm going to see how you pay attention, Frank, because this one is KN95 single-use masks were delivered to Tompkins County recently. Do you know how many were delivered and how they were distributed?
Oh, it's a test. I think there were 40,000 that were delivered, and we used our local human service nonprofit organizations to help get those out. Our focus and goal was to get them to populations that are in need and might not be able to purchase them for themselves. So we want to thank our human service partners for helping us get those masks distributed. And if we do have more delivered, we'll continue to make those available.
And it was a test because Frank wasn't involved in that distribution. So he handles a lot of things, but I like seeing if he's paying attention. Let's move on to self-testing. Do we have an estimate for when the state and federal sponsored home test kits will be available? And how will those be distributed, and to who will they be distributed? And do we know how many will be coming into the community? And Frank, I think you know this one all too well after this afternoon.
Yeah, so I'll start with, I don't know what the federal distribution plan is. We haven't received any information about that yet. So once we do, we'll certainly share that with the community. As far as the state, their initial focus was with schools. And so they provided those self-test kits to us originally back in December, and we turned those all over to BOCES for distribution. And then over the New Year's weekend, they provided them directly to BOCES to provide to our school districts to be sent home with children. So I believe many of our districts have completed that process or are close at this point to making those tests available for students. We did receive yet last night 46,000 self-test kits. No,
4,600.
4,600. Geez, it felt like 46,000. It was 4,600 test kits. We actually, a team of us today were at Dewar putting a sticker on every one of those test kits to direct people how to what to do with the test and where to report it on our self portal. So there was a link, a scannable QR code. So we had a little factory of stickering test kits going on today. So the 4,600 are now separated out and ready for our local municipalities to come pick up. And they will be doing that over the next couple of days. And then we've asked them to distribute them in our communities. So, look for information from your village, town, or city, depending on where you live, about what plans they have to distribute those. We have asked them to focus on people that might not have the means to purchase a test. So know that they're going to be doing some targeted work for those distribution. And also know it's 4,600 tests. While it was a lot to put a sticker on every one, it's not a lot when there's 100,000 plus people in our community. So know that they will likely go quick. And again, we're trying to focus those on people that might not have means to purchase them themselves. But look for your municipality to have some information in the coming days.
Another piece of this testing is on test to stay. And how does that work? And is Tompkins County supporting test to stay? So if you could describe what that is and if we're doing it here in our community.
Sure. Test to stay is a mechanism that the governor's been talking a lot about related to trying to keep students in school. And essentially what it is if you are a close contact to a case and you're asymptomatic, using a series of rapid tests during your quarantine period, if they're all negative, you can continue to go to school. So that sounds really good, right? We want to keep kids in school. If they're asymptomatic, let's test them 3 times over what was, 10 days and keep them in school. The challenge is that's very labor intensive to be able to do that. Supplies are still in short supply to be able to manage it. And then there's criteria to be eligible. It excludes household contacts, so you can't be symptomatic, right? So the number of people that would actually be eligible is relatively small. And so it was a significant logistical lift with minimal value in keeping folks in school, particularly with the change to the 5-day quarantine, right? So we knew that was coming. So in coordination with our local school leadership, the health department's made the decision that we're not going to authorize tests to stay at this point. I believe the adjustments to isolation and quarantine to 5 days, coupled with a new approach to case investigations and contact tracing, is going to have the impact of keeping more children in school and hopefully more adults available to be able to run the schools, because that's really what's been the challenge for our districts and forcing them to go remote is not having the adults available. And I would point out, if you're fully vaccinated and now boosted, you don't need to quarantine, right? So I would encourage the adults, particularly those that are working with our children, please get vaccinated. That's going to help keep you at work, and it's going to help keep our schools in person.
On that, Frank, if a child is fully vaccinated, that's also the same guidance for them?
Correct. So if a child is fully vaccinated, they are exempt from quarantine.
We opened up a self-test online portal, and people would like to know, how is it going? What kind of traffic is it getting? And how does it work if someone needs documentation for work or school? Yeah, so this kind of goes back to that paid leave component. When somebody does submit a self-test into our website, they get a automated email back that has their name, address, the onset of symptoms, and their test date that they entered in. And it gives them information about what they should do for their own health,
what they should do around isolation and quarantine. And then it has information at the bottom that says this is documentation that this person has submitted a positive test result to the health department. We're hoping that will carry the day for most businesses to accept and use for the paid leave. Understanding that technically, I believe the paid leave law requires an official isolation and quarantine order from the health department. But I don't think, I think a business could go, it could take that email that they get from us and offer their employee the ability to stay home. The state's not paying for that paid leave. It's just requiring that the employers offer it. So I would encourage our businesses to accept that letter. And I really would encourage our community to be honest, right? This is not something to mess around with. If you have a positive test, we want you to stay home. And if you need documentation, use that portal for it. But really what we need is that paid leave legislation to be adjusted so that it doesn't require that official order.
So one of the pieces to this with self-testing is the person doesn't have contact tracing done. So how does contact tracing occur? Should that person be doing it themselves? How does that work?
Yeah, we're not asking the individual to do contact tracing. Certainly they should be talking with their household contacts, and I hope they're doing that anyway, right? They live with those folks. So hopefully they're informing them that there's potential. And quite frankly, they're the folks that are most at risk because they're spending the most time around them. So, and we would hope if those folks know that someone in their household is positive, they'll follow our quarantine guidance as appropriate if they're not fully vaccinated and boosted. As far as outside of the household, certainly, let your employer know if you're comfortable with that, so they can, make some decisions about informing people if they feel it's appropriate. But we're not asking people to take contact tracing on their own. This is actually a scaling back of contact tracing, to be completely honest. So it's good to share information if you're comfortable. Again, particularly with those closest to you in your household. But we're not asking people to be their own contact tracers.
And the daily chart, Frank, how are self-tests being reported there? How are we keeping track of them?
Yeah, so we're tracking them separately. They are on there, and each day we report the number of positive self-tests that are reported to us. We do not include them in the overall number. And there's a myriad of reasons for that. We don't know when those folks are going to be released. They're not in our, daily counts for, who we're contacting every day. They're treated differently because we're not case investigating and contact tracing them. So putting them into the larger number would not have worked. And quite frankly, we're pretty close to those case count numbers not being really useful anymore. As more and more testing is happening in more and more places, we don't know about it. And so the true picture of what's going on with testing really is going to become less clear from a health department knowing day to day how much is occurring. And that's okay, right? We've talked about that. Our focus, the shift in our focus that's happened several months ago is to the severity of illness and what's going on with our hospitalizations, which we watch very closely. And we have a great relationship with Cuyahoga Health Systems to get that information on a daily basis. So I just want to prepare folks that we've been providing that information for almost 2 years now, and it's likely coming to the end of its useful life, as far as the daily case counts. So, just know in the coming weeks, perhaps months, we'll be having conversations about whether it's even worth reporting those numbers anymore, while we will always continue to focus on what we think are the most important measures for how we're dealing with COVID in our community.
And Frank, I do want to point out to anyone watching that there are informational videos available online about isolation and quarantining, especially with household contacts. And so again, on our website, there's more information. We had just talked about that and you gave some guidance on that. But if people need to know a little bit more about how to isolate and what quarantine is, I think that's all available on our website. So we'll share those links. Talking a little bit more about testing, the community testing site at the shops at Ithaca Mall, it was experiencing some capacity issues. Mm-hmm. Is it better to do an at-home test instead of going to the mall? When should you go to the mall? And how is the mall site doing?
Yeah, great questions. And yes, there were certainly backups at the mall. It's relative though. I always want to point this out. Our backups for how long it takes to get a test, other places wish they had that it was that quick. So all credit has to go to Cayuga Health Systems for standing up since March of 2020. Remember, this started for most people in March of 2020, and they stood up testing at that point and have been doing it since. And yes, there were backups. Much of that was related to holiday gatherings, events, travel, right? We were telling people get tested before you do that. And the home tests were not readily available. So we were also telling the higher ed students, please get tested before you go, right? So we would know, so they wouldn't be taking, an active case back to wherever they were heading. So that put extra demand on the system. So a couple of things. First, Cayuga Health Systems is working on expanding capacity at the mall. So they have always been responsive when things like this happen, and this is no different. So they are working on that. But I think the more important question you asked, Amy, was when should you go to the mall, right? So first, if you're symptomatic or you're a close contact of someone that is known to be a case, that's who should be going to the mall, right? Because those are the folks we want to get a PCR test on, one, to confirm if they do have COVID, or two, to confirm if as a close contact that, they do now have COVID and should be in isolation. They should be in quarantine anyway, but isolation as well. So so that's who we want to go to the mall. If you're doing screening testing, right, you're going to a family gathering, or you're going to an event that requires testing ahead of time, or you're going to travel and you want to test ahead of time, or you're returning from travel and you want to test to see, where you stand. That's really where the over-the-counter, the self-tests are more appropriate, right? Because they're a screening tool. You're not symptomatic. You don't know that you've been exposed to somebody that has COVID, but you just want to know based on your activity or behaviors if you might have COVID. And so those tests are really good for that purpose, because they're going to tell us if somebody has COVID that we might not otherwise have known about, right? Because if they're asymptomatic, they're not going to go to the mall, right? So I traveled, or I got together with family, I feel fine. I'm not going to go to the mall and go through, getting a test, waiting a few days. So the usefulness of those over-the-counter or self-tests are in the moment, you have a better idea of whether you're positive or not. They're not perfect, right? Nobody's claiming they're perfect. There are false positives. There are false negatives with them. But if you take a test before you're going to a family gathering, for example, and you test positive on it, and you don't go to that family gathering, you've now interrupted the transmission of the disease, right? Because if you didn't take the test and you didn't know, you felt fine, you could be transmitting it to everyone at that event, who then goes about their lives, who then transmits it to other people. And that's how the disease kind of, continues to move around. So anytime that we can identify a positive case before transmission occurs is a good thing. So go to the mall if you're symptomatic or are a close contact. If you're feeling okay and you're just doing it for screening purposes, over-the-counter tests, self-tests are the way to go.
All right, thanks, Frank, for that. And one of the things that has been recently announced is additional New York State testing facilities that are open and free to throughout New York State. There are now ones open in Watkins Glen and Moravia, which are also close by for those of you that may want to go to those sites as well. But similar to what you just said, use that like you would the mall site, and at-home tests for those when you're going to be, checking before going to different places. So I do have a follow-up question about schools. How do we manage school lunches if students are coming back after 5 days? Because they obviously wouldn't be able to be masked. Do we know anything about that, or is that in the upcoming guidance that you're talking about?
I think we're still, we found out last night that the guidance was changing to 5 days. Today, we've been scrambling and working to address those people that are currently in isolation, 6 to 10 in the 6 to 10-day framework, to get implemented a plan for new people that are identified. So we've been a little busy on that front. The general direction right now is school guidance has not changed. But more will come, right? More will come as we get guidance about case investigations and contact tracing, hopefully early next week. And then we'll be working with our districts to try to understand the new guidance and figure out how to implement it successfully here.
All right. I'm going to go to the other prevention measure we have, which is vaccinations. The local vaccine rates, are they going up? It seems that the tracker has been a little bit stagnant again.
Yeah, I think from a first and second dose perspective, things have leveled off, right? They went up for a little while because we added the 5 to 12-year-olds. And by the way, we're still doing those. We've got second dose clinics at some of our local schools Thursday and Friday. And we're planning more for some of the schools we haven't been to yet in the coming weeks. We're also planning for the homebound. I know there's been a lot of questions about that. We haven't forgotten about those folks. We are planning to get out there hopefully in the next couple of weeks to start that population. But I think from a first and second dose, things have leveled off. Our vaccination numbers are pretty high. So that's good. They're not as high as we'd like them. So please go get vaccinated if you haven't. On the booster front, we don't have that data. New York State hasn't been able to provide it to us yet, and we're not doing enough volume of booster doses ourselves for our data to really be relevant in the total booster, kind of approach that's been occurring. So we're hopeful that we'll be able to get that information from New York State in the near future about where we are on boosted. But I can tell you demand has been high in Tompkins County. I think we said this the last time we had a town hall. It was hard to find a booster dose in Tompkins County. That wasn't the case in counties around us, right? So it wasn't a shortage of, it wasn't a universal shortage of vaccine appointments. It was increased demand in our county that was unusual in our region, which is a good thing. It means people were seeking out vaccine boosters, and I'm very excited that that's the case. And once again, super proud of our community for responding. So what that means is we got to figure out how to solve that problem. Excuse me. We did have a clinic in December. We're having another one this Saturday. There's still appointment slots available. So if you're interested in a booster dose, it is a Moderna clinic. So for those 18 and up that are looking for a booster, please sign up and come out and see us Saturday. And we are planning to do those on the Saturdays through January, as long as there is demand. Our goal is not to take over as the vaccine supplier in the community. Really, our pharmacies and healthcare systems should be doing that. What we're doing is trying to address the backlog to get as many people in large numbers boosted as possible. So that frees up appointments in those other places for those that want to go to their healthcare provider or their pharmacy. And as more children and young people become eligible for boosters, we want them to have places to go get appointments as well. So if we can get the backlog kind of taken care of here over the next few weeks, hopefully that will free up appointments in those other venues.
And Frank, our booster clinics have been predominantly Moderna. Can you talk a little bit about the boosters and this mix and match and how that all works?
Yeah, so you can get boosted with any of the 3 vaccines if you're over 18 years of age. So let's say that first. If you're over 18 years of age and you got Pfizer, you can get boosted with Moderna and Johnson. If you got Moderna, you can get boosted with Pfizer, Johnson & Johnson, or Moderna. If you got Johnson & Johnson, you can get boosted with Pfizer or Moderna. We are recommending that folks get Pfizer or Moderna rather than Johnson & Johnson at this point, just based on the efficacy data associated with it. But certainly you have the option to do that. If you're under 18, the emergency use authorization is only for Pfizer. And so you would have to seek out a Pfizer dose if you're, between in what I think now is 5 to 17. We have been focusing on Moderna because it's one of the easier vaccines to handle with its freezing and refrigeration requirements. And so that's really been the purpose. We did over 1,100 people last Saturday. We've opened up 1,200 appointments this Saturday. It's very difficult to do that volume with different types of vaccines available, right? So it's kind of a give and take on, do we want to have the volume or do we want to have choice? And right now we've chosen volume so we can get as many people boosted as possible. And that's why we've been using a Moderna at our booster clinics.
So you talked a little bit about it. Has there been approval for boosters children ages 12 to 16? What are the updates there?
Yeah, and I'm gonna be careful because I haven't been following that in the last couple of days and weeks, as there's been some talk about addition. I believe the 15 to 17 has already been approved for boosters, and they're either close or they may have just said the 5 through 15. So we'll get some information out there for you. I don't want to say the wrong thing, but I think very soon we're going to be in a position where everyone 5 and up is, eligible for a booster if the time has passed. If that isn't already the case, I imagine it will be relatively soon.
And those boosters, just as a reminder, are 6 months after that second dose. So that also plays into the eligibility. Yeah. We are talking about boosters, and colleges are requiring boosters. Can you talk about any precautions that the Department of Health is taking, as we know college students will soon be returning, and how are we working through that?
Sure. So from a booster dose perspective, we do hope there will be capacity in our clinics in January for students that might not have gotten boosted or are here year round and never left and need a place to get a booster. I do know that our higher ed partners are looking at ways to make boosters available for their students, as they return. Many of them are asking the students to get boosters before they return, but just the timing of when they got their first doses, they might not yet be eligible for a booster dose. So, that's part of this too. But from a broader perspective about students returning, we've been working very closely with our higher ed partners, Cornell, TC3, Ithaca College. We meet on a regular basis to talk about planning, and they're all in the midst of figuring out what the start of their semesters will look like. And I'm sure there'll be information coming out soon to their populations about, how the semesters are going to start, what testing requirements are going to look like, when classes will start, all of those kind of things. So stay tuned, and I think soon we'll have, more information about that.
And those youth boosters for the non-college students, will we be hosting any of those clinics, or will they be primarily through pediatrician offices?
Yeah, we're gonna see, right? That's part of where we are. So, one of the benefits of the health department's responsibilities in case investigation and contact tracing reducing is it frees up resources, which hopefully we'll be able to refocus on vaccines, over the next few weeks and couple months. I can't answer that question because I don't know. We're in the planning phases of trying to figure this out. My hope is that vaccine is readily available in the community. And that doesn't mean that the health department is providing it, but that it's readily available at some location. What we want to make sure is that if there is a backlog and people are unable to get those appointments, that we can figure out ways to make those vaccines available, so that way the backlog doesn't exist. So I guess the short answer is, if appointments are readily available in the community through pediatricians, through pharmacies, we likely would not do clinics. If they're not, then we would talk about planning clinics of our own to help alleviate that stress on the system.
So vaccines in 2020, just a couple of what if questions. Is it anticipated that we will need another booster after 6 months of the first booster?
Yeah, I don't know. I don't know. I wish I had a crystal ball. Boy, that would have been helpful in March of 2020. But we don't know, right? That's the truth of it. And I know that's hard to hear. And I know that creates some negativity towards vaccines, but we have to see how the disease evolves, and we have to see how the vaccine works against the evolution of the disease, right? There are some vaccines like the flu that we ask folks to get every year because there are new variants that we try to address to create as much protection. COVID could end up being that way, or we could find out that with a third booster dose, people are maintaining longer protection against the predominant strains of COVID in our community. We just don't know yet, and we won't know until until there's time for the research to kind of understand how our bodies are reacting to the vaccine and the new variants of COVID. So don't be surprised if there is. Don't be surprised if there's an annual recommendation like the flu shot. But also don't be surprised if the third one is the one, right? Because we have many vaccines that you get 2 or 3 doses of, and that's enough. And your body now has the immunity to fight off the disease if it encounters it.
So what about the vaccines for children under 5? Do you know anything about those?
I don't know when they're coming. I do know they're working on it, right? And as I've said, every time I've gotten asked about this for every group of people, we don't want to rush it. We want to move quickly, but we don't want to rush because we want to make sure that the vaccines are going to be safe and effective for that next group of people that we open it up to. So the research is ongoing. Hopefully we'll know something soon, but I want to know as soon as it is safe to provide those vaccines and no sooner. So we'll let them do their work, and hopefully we'll know in the near future whether or not we'll have vaccines for those under 5.
Are there new vaccines still being developed at this point?
That's a good question. I don't know the answer to that, to be honest with you. I really don't. I'm really more focused on what's currently available and how we're going to get it to people. So I don't know the answer to that question.
This is the don't know section of my questions, Frank.
Okay.
So we'll keep going. Are the vaccines proving to have an impact on the Omicron variant?
So, I don't think we can definitively say anything yet. I think what we know is that vaccines are helping keep people out of the hospital. Our local data shows that. Omicron's been with us, at least identified with us for, I don't know, it seems like 2 years, but it's only been like a month or so, right? So it's hard to know for certain exactly what the impact is. But I think, we are a highly vaccinated population. Our higher education students are a highly vaccinated population, and they are the ones that saw the most significant Omicron spike. And we did not see severe illness from that. It's hard to know whether that was the vaccines or whether it's just the nature of younger, healthier people being exposed to a less virulent virus. Right. So I think studies will come and we will eventually have better information about that. But what I would suggest now, vaccines are keeping people out of the hospital. We know that. And so whether it's Delta or Omicron, the best way to protect yourself is to get vaccinated. Eventually we'll know more about Omicron and the vaccines, but right now Delta is still out there, and we want people to be protected.
For those who haven't yet received a vaccine, which one should they get? Any updates on efficacy, or how do they make a decision, and where can they get that first dose?
Yeah, it's a good question. I think at this point we're recommending the Moderna and Pfizer as the primary vaccines for folks. And not to say that Johnson & Johnson is a bad vaccine, but based on what we've seen around efficacy, particularly with boosters and such, that if I was to make a recommendation right now, I would tell folks to seek out Pfizer and Moderna. My hope is that first doses will become available in pharmacies, doctors' offices, and such, where folks can get their first dose and second dose, from those sources. I think if we can get the booster kind of backlog taken care of, those other sources have more flexibility to provide different types of vaccine, first dose, second dose, boosters, children's doses, than we can at a large scale clinic. So we're going to focus on getting that backlog up, and then hopefully people will be able to find those appointments with their healthcare providers or their pharmacists.
Any updates you have on medications for COVID?
Yeah, so it's been a little harder to follow. I believe there's been emergency use authorization for a Pfizer based product that is an antiviral. I think I heard that it should be hitting the market relatively soon. And really what that is if somebody is symptomatic and is at high risk, it's a prescription medication that their doctor can provide, and they'd be able to go to their pharmacy. What I don't know about is supply and what that's going to look like. As you can imagine, anytime a new medication is approved, it's not magically available in a volume that everyone that wants it can have it. So there, it may take a little while. There may be a prioritization on who's eligible for that. We don't have that information yet. So once we do, we'll certainly share that, both who's eligible and how to access it.
And then I have another question that came in, not related to vaccines, but related to the mask mandate and advisory. Can you discuss how we're enforcing the state's mask mandate here in Tompkins County?
Sure. So we have the portal on our website for folks to report compliance issues. Our environmental health division is monitoring those complaints. We generally start with just an informational communication to businesses. If we see repeat complaints, then it's a more formal reach out to find out what's going on, to make sure the business knows what the rules are and that they have the appropriate supplies, signage and such. And so far that's worked. It's not our goal to close a business or find a business around mask wearing. What our hope is that as they have throughout the pandemic, our businesses have responded. And I think just anecdotally, my experience has been masks are being worn at high levels in many of the major retailers in town, and that's good. And certainly signage is up, and I think people are taking it seriously.
So Frank, we are now coming into March of 2022, is not far off. As you start to think about your crystal ball and can tell us kind of what is to come. You started this tonight, our town hall, with some of your thoughts, but if you want to recap those and let people know what your expectations are for the next couple of months as we continue to kind of ride out this COVID wave.
Sure. So it's mostly good news, right? I want to start with, the important piece that COVID isn't going away, right? COVID is still with us, and COVID is still a significant risk for the most vulnerable people in our community, the immunocompromised and our seniors. And we still have to work to protect those folks. So when we're asking you to wear a mask indoors, it's about protecting those folks, right? I know I hear about government control and all these other things. I don't care about any of that. That's not who I am. I'm just a public health practitioner. And the best way to help protect those folks, besides getting vaccinated yourself, is to wear a mask when you're around them. And they need to go to the grocery store. They need to go do the things that they need to live their life. And I hope to think it's not too much to ask to wear a mask to do that. So, those things are still going to be with us for a while, because we have to protect those most vulnerable folks. But we're transitioning, right? We're transitioning from pandemic to an endemic state. And really what that means is, COVID is going to be part of the disease profile in our community. And we're going to continue to adapt to it. But we're going to get back to our normal community activities. I'd imagine, we're going to see fluctuations in COVID over the next, 2 or 3, maybe 4 months as we get through the winter season. And hopefully we'll know more about Omicron and be more confident in its impact on our community. And we'll be able to start saying, okay, we've got vaccines, we have antivirals on the market. We're going to have some precautions for, the most vulnerable, folks in nursing homes, adult living facilities and such. But generally speaking, we'll be back to normal, right? And so I think this is the first time in almost 2 years that I feel confident saying that in this year, we're going to feel normal again. I don't know exactly when that's going to happen, but I do think we're heading towards that, and folks should feel good about that. They should feel good that we're getting back to normal, but they should feel good, particularly in Tompkins County, that we did what was necessary and we saved lives. You don't have to look very far from our borders to see different approaches and different community reactions to public health guidance and the impact that had on disease in those communities, including deaths, right? Obviously, we've tragically lost members of our community, but it could have been much worse if we had reacted differently. And I can't thank our community enough for that. It's a pleasure to do my job here because I know that people care about these things and care about each other. And I'm confident we're going to do that over the next few months to get us kind of to that point where, you know, we can say we've done everything we can. There's still some things we're going to continue to do to protect those that are most vulnerable, but we made it through and we saved people in our community, and it was all worth it.
Well, thank you, Frank. As you were talking, you kept saying the word community, and so I was like, what does that even mean? I mean, how do we use that? Because that's a big piece of this. Is we have been thankful for this community we have, and the definition is a group of people living in the same place or having a particular characteristic in common, or a feeling of fellowship with others as a result of sharing common attitudes, interests, and goals. And I think that's the biggest piece for this. As we start moving forward, it's taking care of one another and having that self-responsibility. And I think that's a big piece of what you've talked about tonight. So thank you for your time, and thank you for your honesty and candor as you answered all these questions. Thank you everyone for joining in, and we will see you hopefully in the next town hall, which is all good news. So thank you.